Hi everybody, this is Dr. Rick Rosenfield and
Dr. Nicholas Fogelson from the Pearl Women's Center, and this is Ask the Pearl, Episode 2.
as I think you guys know, we are a couple of gynecology doctors based in Portland, Oregon, and we've decided to do this weekly podcast and blog, video blog, regarding various topics of interest. Last week we talked about birth control pills, right, Nick?
Right, we talked about combined oral contraceptives, the birth control pill, and we are committed every week to answering questions that come from the audience, and we were fortunate to already get a few. So before we jump into the new topic, we're going to hit some of the questions we got from the last episode.
All right, so one question that came in that made sense, and funny enough, we actually recognized as we were editing the video that we neglected to bring this to your attention, but it makes good sense. The first question was, how do we actually start birth control pills? How does a patient, when they get a new prescription, how do they know what day to start and how to start the pill?
Right, so we were talking about this pack of birth control pills last time, and typically there are two ways you can start a birth control pill. One is something that traditionally is called a Sunday start, and if you look at this pack, in fact, if we put it up there, you can read that it's going to say Sunday. Now, the way this computer works, it reverses everything, so it looks like it's in a mirror, but it does say Sunday in the upper left. And basically, if you take that first pill on a Sunday, then by the time that pack is done, you will have reset your menstrual cycle to be at the end of that pack, and it just happens to be that you won't bleed on the weekend. That is the entire reason for the Sunday start protocol, is it makes you have your menstrual cycle during the week, and most people would prefer to have it during the week, and so that's why they did it. However, that was come up with long ago. Now we have new ways to start birth control. And now, actually, there's a very evidence-based protocol to suggest that what we call convenience start is probably the best way to take them. And basically that means is that when you get your prescription for birth control, just start taking it that day. And what we find is that when people do a convenience start, the likelihood is greater that they will continue birth control pills and that they won't have unintended pregnancies.
And getting to that point, the number one reason why we see contraceptive failures with birth control pills is not because the pills are ineffective. It's that the patients forget to take the pill, or they decide never to start the pill at all. So one thing that we do want to review is if you do the convenient start, depending on what time of your cycle you're in, you may also opt to use backup contraception, right, Nick?
Right, exactly. And it gets a little complex into the birth control cycle, but if you start a convenient start right around the time of your menstrual cycle, it's going to be good right away. But if you've already gotten far enough along in the month that you may have ovulated, it's actually not going to work at all until the next cycle. And so that's a little technical. You could talk to your doctor or your healthcare provider about where you are in the cycle, or you can just plan to use backup contraception for the first month, and that's really the safest way.
And absolutely, for those of you that are getting a prescription for birth control pills, if you've got very irregular or unpredictable cycles, we would certainly recommend that you use a backup type of contraception like a condom or some other barrier type of contraception during that first pill pack. We certainly do not recommend the rhythm method in general as a method of contraception as being reliable. There are a lot of folks that come in, unfortunately, that get pregnant when they think that they can't get pregnant, or if they're having irregular cycles and they start in that convenient fashion.
So the next question we had, going along that lines of contraceptive failure from not taking the pill, is that what do you do if you miss a pill? Because sometimes the problem with birth control is that you just forget to take one. So Rick, what happens if you miss one?
Well, as soon as you recognize that you have not taken a birth control pill, the recommendation is to take a pill as soon as you can. So if you get up in the morning and the normal pill time that you take your birth control pills is morning and you forget to take your pill, midday you remember that you didn't take it, as soon as you can take a replacement pill, you go ahead and do that, and then you start taking your birth control pills the following day at the regularly scheduled time. Now, if you miss 2 pills in a row, you can do the same thing. You take the pill that you forgot and then start taking the follow-up pill the next day. If you miss more than 2 days in a row, we have to recommend that you use backup contraception. And if you miss that pill in the middle of the cycle, it may also make sense to use some backup contraception for the rest of that month because, of course, we're trying to prevent unplanned pregnancies.
Exactly. So miss one pill, take 2 the next day, or that one as soon as you can, and then take up the next one. If you miss 2, you need to use some kind of backup contraception. And it does get a little more complex from that if you want to split hairs about when you miss it in the month, but we're not going to go that far into it. On a simple level, miss 1, take it as soon as you can. Miss 2, you need backup contraception.
Now, the last question that we had was an interesting one as well. Someone had written in and asked, what is the mini pill? And it almost sounds like it's a pill that's smaller than another pill, but that's not actually what people mean when they say mini pill. As a matter of fact, what mini pill is referring to is an actual hormonal recipe, which is...
It's just progesterone. So a normal combination birth control pill is estrogen and progesterone. A mini pill is progesterone only. They do work. A mini pill is an effective method for birth control. However, when you look at the Pearl Index, it's funny, we're at the Pearl Women's Center, but this particular Pearl Index has nothing to do with us. It is an index of how effective birth control is. A progesterone-only birth control pill is about 94% effective, which means that 6 out of 100 women are going to get pregnant over the course of a year taking the mini pill alone, whereas a combination birth control pill, the Pearl Index, which again has something to do with us, is about 98, which means only 2 women out of 100 are going to get pregnant. So nothing is 100%. Combination birth control pills are actually better than progesterone birth control pills. And the real reason is that progesterone-only birth control pills leave you with absolutely no room for error when it comes to missing a pill. If we were talking about missing a pill with a combination birth control, and then if you miss one, you could take one the next day. If you miss a pill with progesterone-only birth control pills, you can get pregnant almost right away. And it has to do with the way the hormone cycle works and where the cycle gets arrested by the pill. But people on progesterone birth control pills are ready to ovulate as soon as they miss a pill. Whereas people that take a combination birth control pill are actually anywhere from 7 to 14 days from ovulating when they miss a pill. So there's really a lot more room for error. The reason why people use progesterone-only birth control pills is there may be more side effects from estrogen in some cases, although most people do great on them. And the other is for breastfeeding women, is that we don't recommend using a combination birth control pill when people are starting breastfeeding because it can interfere with lactation.
Very good. Okay, well that was the questions from last week. I think that it might make sense to separate this episode into a part 1 and part 2, and that way if you don't want to listen to the explanations, we can just go to the part 2, which would be about pap smears. What do you think about that idea?
All right, so we're going to sign off, and if you want, you'll get the next one, which will be part 2.